Divers. Just wanted to stop by and talk a little bit about Medicaid and the cuts that are being proposed on top of the new requirement that this regime wants to put on Medicaid. Now, Medicaid already is a very difficult program to qualify for, and it's definitely designed for those that are oppressed and that are those that are super vulnerable in society. That's the purpose of the program, and that is the people that are receiving Medicaid. And there's tons of people that need Medicaid that can't even qualify. So let's not even try to act like everybody's jumping on the bandwagon. But now they want to add a component, a working component to Medicaid. A lot of the people that have Medicaid have it because they cannot, by any means, afford health insurance. On top of that, why would you put a work requirement on something that is supposed to help those that need it most? And I know people are tempted to say, oh, but people are taking advantage, or people are committing fraud, or anything like that. Let me tell you something. Healthcare is a human right, period. You should not have to produce anything or certify yourself in order to receive medical care. That is a human right. And until we wake up and realize that not only are we funding healthcare out of our pockets, paying ridiculous premiums on private insurance or Obamacare, and on top of that, paying a ridiculous amount of tax, we need universal health care, people. I know you've been following and been propagandized for the longest to tell you that, oh, they're going to raise the taxes and it's going to be untenable. All of the other global powers have universal health care. We are the only G7 nation that does not have that. You need to ask yourself why. That is thanks to the big interest and big pharma. We need to start advocating for our right. Again, healthcare is a human right, and it should not be kept from anybody.